My name is Nicholas Powers. I grew up in Medway, Maine. I attended the University of Maine in Orono for nursing. I've been a registered nurse in the neonatal intensive care unit for a little over a year now as an RN.
Nick is working the overnight shift in the neonatal intensive care unit at Northern Light Eastern Maine Medical Center in Bangor. He cares for the smallest, most delicate patients, preterm babies born before 37 weeks, low birth babies less than 5.5 pounds, and babies with health conditions requiring special care.
Usually we have about 3 babies per assignment, depending on how sick they are and what's going on. We feed the babies every 3 hours usually, so every 3 hours we go, we wake up our baby, we assess them, we change their diaper, and we feed them. Sometimes if things go wrong or something happens between those 3 hours, then we have to intervene. The stress level is always different, like any job, you have easier days and you have harder days. On the harder days, I'm really thankful for the team that is in the NICU. They're really supportive and come to your aid when you need it and offer you advice, and there's a lot of learning opportunities here.
Nick was somebody that from day one showed up professional. He showed up just wanting to learn, and he's always had this he just craves to learn something new. So he's a huge asset here in the NICU.
Nicole Arranger is nurse manager in the NICU at Northern Light EMMC and is Nick's boss.
It can be a very stressful time for families. We are really here for that emotional support while giving the best medical care we can give. You're dealing with really hard situations, but really great outcomes, for the most part.
Key to Nick's education, as with all nurses, is real-life training or near real-life training.
Simulation is a huge part of nursing education. We use them in our main simulation down in the education lab, where our clinical education department does our new nurse training. We do a lot of mock codes, getting people comfortable doing skills without an actual patient.
The results of that intense training play out daily in the neonatal intensive care unit.
A good nurse in this unit is someone who can kind of think on their feet and adapt to very rapidly changing situations. Our patients are very critical and they're in the smallest sizes. They need to be detail-oriented so that they can do the medication math to make sure they're giving the right doses of medications to their patients and that they are caring for them as a whole.
That adaptability Nick traces to his professors and classes at the University of Maine. He says they instilled encouragement and goal setting.
Success is when you set a goal or something that you want to achieve and work tirelessly at it for weeks to months to years and are really committed to that goal, and then you finally achieve it and all that work has kind of paid off. That's what success is. I feel very proud.
Say yes to college. Say yes to success.